But first, like a lot of people, I was pretty shocked to get the news about Whitney Houston dying just the night before the Grammys. The coroner says it's going to be weeks before we know the cause of death. That's important. But given her history of drug abuse, people are asking a lot of tough questions. Investigators did find prescription drugs in the hotel room where Houston died. But the coroner told us something very important. Listen to this. Listen carefully. Quote, "Nothing out of the ordinary was found as long as Houston was taking the medication as prescribed." As prescribed. That's a key point. As a doctor, I want to dovetail on that by giving you this shocking statistic. 1 in 20 people over the age of 12 take prescription medications in a way that's not prescribed. Another key point. Most of them are not addicts. They're just careless, or maybe they didn't heed the warnings they were told. They take too much, they take it in the wrong way, or they combine medications with something else. If you do that, it's easy to make a catastrophic mistake. And every 19 minutes, a person dies from prescription drugs. Now, this goes far beyond what may or may not have happened to Whitney Houston. I want to be clear on that. But I also want to talk to you about the dangers maybe that everyone faces at one point or another. So joining me from New York to talk about this is Dr. Petros Levounis. He's Chief of Addiction Psychiatry at St. Luke's and Roosevelt Hospitals in New York City. Thanks for joining us. I imagine, Doctor, you like everybody else have paid attention to the story of what happened with Whitney Houston. But I did want to sort of make a couple points here. I want to ask you about them. Even legitimately prescribed medications can kill in combination with other drugs and sometimes alcohol, but even just small amounts of alcohol. I don't think a lot of people understand that. They're told, look, don't drink with these medications, but this idea that in combination they're so much worse. Can you explain what happens? Why is it so much worse? What happens to the brain?
What happens to the brain is something that can be quite scary, actually, and that is the synergy, a synergistic effect. And synergy simply means that the total effect can be much, much bigger than the sum of the parts. So if you just drink alcohol, you have some kind of effect. Or if you just take, let's say, Valium or Xanax or one of those medications, you have another effect. If you take some painkillers, some opioid painkillers, you have another effect. But if you combine these three, then it's not just, the effect is not simply additive. It's not just 1 + 1 + 1 = 3. It's more like 1 + 1 + 1 = 5 or 6. And that is what gets a lot of people in trouble.
Can you put this in a little bit of context? Because even as I've been talking about this, people have come up to me and said, look, I hear what you're saying about synergy, but I take sleeping pills. I might have something to drink, at night before I go to bed. And to be clear, that's a problem. We're not talking to say that you need a large consumption of these medications to cause a potential catastrophe. Is that right?
Right. So we do have the synergistic problem, which is a very serious one, and then we superimpose on that one the tolerance problem, that a lot of these medications can result in physiological dependence, meaning that after a while they do not really have the same punch, the same kind of effect that they used to have. So you start adding a little bit and you go up on the dose a little bit, sometimes totally within the recommendations of your physician, but you go up and up and up, and then you may reach a breaking point where the side effects, meaning in this case the respiratory depression or any other kind of physiological trouble that they can give you, gets out of control and you may end up dying.
And one of the areas of the brain that I think is affected is the hypothalamus. That's part of the brain that's responsible for a lot of things we don't think about, regulating our heart rate, our heartbeat, but also our drive to breathe. And when you say depressing that, I think that's what you're referring to. Is there a particularly dangerous combination, something that surprises you both in terms of what the medications are and how little can cause a problem?
Some of the opioids, some of the painkillers have been notoriously implicated in overdose deaths. Sometimes we think that pain pills cannot possibly be as dangerous as heroin, and yet they're very, very similar drugs and can very easily kill you. So that's what we see. We see some people taking OxyContin or Vicodin and say, hey, the dentist gave me this. How can it possibly be all that dangerous? And yet, when taken in combination with alcohol or with some other drugs, or sometimes even by itself, can get you in trouble.
Yeah, well, I appreciate that point. But look, the status quo is not acceptable. So if the message needs to be clearer and it needs to be louder and it needs to be, you know, you don't want to be alarmist, but you got to, I mean, I think it's very, very important for doctors to communicate this to their patients, which again, I appreciate that you do and I try and do as well. Maybe we'll have you back on to talk about this some more. We're going to stay on this, Dr. Levounis. I appreciate your time.